Bowhead Futures presents digital health at the front lines. We explore how healthcare is shifting by deep diving with the doctors transforming the system from the inside out.
I'm always talking about how we can use digital health to democratize healthcare and, and then now I've been learning about, and not so learning about, but almost reminded about the digital divide in different countries and jurisdictions and parts of the world that have very little access to digital health. So yeah, I'm curious if you have any kind of thoughts on the digital divide and specifically how we can use digital health to empower more equitable health.
We don't see a world where public health shouldn't be involved in any industry. But by definition of what we do is we're population-based initiatives, right? So if you're any product that has, real scale and you're population-based, you have a public health model. There is some duty on you to ensure that what you're saying and what you're doing is benefiting the population at large and not harming it. What happens in a pandemic and what's happening in general is that we're good at finding market inefficiencies and then attacking them. And we have to have this intersectoral approach in healthcare and in public health in general. You mentioned that I have this MD and MPH. I'm also not a coder, right? I don't have the ability to understand AI the way someone else would. I can talk about the data bottlenecks and what we need to see and how to protect patient information, but I wouldn't know how to design that. And oftentimes, just having that professional or that knowledge set in your circle, whether it's at the executive level or from a consultation standpoint, it helps inform your programs and your products in a way that in the past you may not have done. And again, I think if we take a patient-centered approach with how we roll out digital technology, with the patient should always be at the center, right? And how do we connect this patient to the services they need, right? And so I think right now we have there's a lot of silos that are trying to connect with each other, and we need to connect everything, right?
Yeah. So it sounds like a complete revamping of the model to more of like an outcomes or values-based approach. It makes me think that, we need to have more public health people, expertise in innovation in tech companies and the startup world. I really do hope to see more of that.